We're calling the meeting to order. Bobby, can you give the preamble, please?
Yes, so we are meeting today on November 10th for the Board of Health, and we are meeting hybrid. Our meeting can be accessed at our location 18 Mulberry Street, or you can join us via Zoom. The meeting ID is 863-9978. 9686, and the passcode is 271193. Or you can join us by phone at 1646-876-9923. And if there's any problem accessing, please use this phone number 603-821-2049. And we're just having, you can see that we're a little juxtaposition there, sideways. We're going to troubleshoot and see how we can get ourselves straightened out.
Okay.
Al is working, it's just giving us a lateral look.
A new view.
A new view.
Always good to have a new perspective on things.
That's true. That's true. So I'll try to keep my volume up so that the owl can hear me. We don't have it on the agenda, but you should have received the minutes for the last meeting.
Yes.
The format, I love the format. It's easy to follow how my notes are.
Well, also how it has on the bottom,
Yeah.
the to-do list and who's responsible and the proposed time frame. I think that's an excellent addition.
Yeah, that's how I do it on my other meetings too. So anyway, it's in front of you. I hope you had a chance to read it or analyze it or correct or amend. But I'd like to see a motion to move the minutes, please.
So moved.
Thank you. Second, Chuck, second. All in favor?
Aye.
Aye. Thank you. It's been approved. I know the director has to have another meeting and we'll get kind of late with all this stuff, IT stuff. So Bobby, would you like to give us your report, please?
Yes, I will. And what I will do is I'll start out by giving an update just to the numbers. When you received this report, it had the COVID number for New Hampshire as of the 5th.
Yeah.
And I just want to make sure that I give the updated numbers here. We are steady seeing across the globe. The cases have sort of stabilized and now they're starting to slightly go up. Nationally, the same thing, numbers are starting to go up. We're in a time of season where more people are going to be indoors, which allows for folks to congregate a little bit more together. And we also have expected that numbers will go up around this time of year. And so that's what we're seeing.
Plus the holidays.
Because the holidays, yeah. COVID update here. Numbers. And then the dashboard was down for a while. So then we were really excited when it did go back up. And then we were seeing these really high numbers. And so I did ask the state to clarify if these are true numbers that we're seeing. And it turns out that we are seeing these numbers. COVID dashboard. So, all right, here we go. Here are the numbers. So you can see on Wednesday what those numbers look like there for us for New Hampshire. As of right now, we announced 363 cases for November 9th, an average of 646 cases per day. And that is over the past 7-day period from the 3rd to the 9th. And this is a 25% increase compared to the previous 7 days. Our total cases for the state are now up to 141,707 with 5,029 active cases. The positivity rate is up 7.2% and is an average of 9,704 tests being conducted daily. Now, the good thing about this is that people are getting tested, and that's what we want, because in order for us to really know what an approximate disease burden is, people have to get tested. So then we also know that this number may also be underrepresented because there are people that are not getting tested. And so with this, with the numbers that we show here, you can see we're still at substantial spread. We still need for people to take precautions, wearing their masks and getting vaccinated. In the state, there are 218 individuals that are currently hospitalized, and the number of deaths is 1,613. And what's that? 1,013. So that's up. That's up even at least 70 more than what I had on here from that's quite a bit. That's a big jump. No, it can't be 70. Anyway, that's a nice number there, which we know we don't like to see that. And so if you, on the state website, you can just see how these numbers, we're in an upward trend right now, and again, as expected. Financial update, I'm gonna have, Flavia is here. I thought I saw her. Flavia will give the numbers for Nashville when she gives her report out.
Okay.
As far as a financial update, the state has awarded us an additional $114,000 in an amendment. There was $27 million that our governor, executive council turned back to the feds, and the governor was able to find 4.3 or 4.7, somewhere between $1 million that was a part of that 27 million. And he found these funds in the offer and the city readiness initiative dollars that we received in the state. And so he was able to push that out to the regions. The loss of that 27 was going to prevent many of the regions from being able to do some of the vaccine work that we really need to have happen, as well as some of the other services that are provided for prevention. And so he was able to find that. And for those that were able to get it through and back to the the governor's office, they're voting on that today to put those contracts out as soon as they can. Our city processes are a little bit slower. So as a result, our things have to go before. Our schedule is interesting with the Board of Aldermen. So if you miss the Human Affairs meeting, you have to wait a whole other month, and then you have to wait a month. So it'll be a while before it gets there, but I'm hoping that we
can make
get
special
it.
meetings.
I'm sorry?
We can make special meetings.
I'm hoping that we can do that. Other than that, this won't be coming to you all for another month or longer. Because human,
The idea is
Have to give it a fair meeting on Monday,
exactly.
so that means it would be another month.
if we don't do anything, but we can.
Yeah.
Right.
And
I would say,
reasonable for, yeah.
So I'll ask for that, because other than that, we have to wait for that. And that includes about $9,300 extra dollars in emergency preparedness, which allows us to do these vaccine clinics that we'll be doing. Policy updates, the managers picked out some from last month. They may present out on ones that will affect them. There were just a few that I had on here, and there is a little bit more language for some of these LSRs right now. Some of the ones that I had listed look like they came off. They were probably inexpedient legislature, just pulled them off. The ones that we really want to look at and make sure that we follow are this 2022-2060, which is relative to the Opioid Abatement Trust Fund. We want to make sure that that legislation, if this legislation supports the Opioid Abatement Trust Fund, we want to support it. If it's something that's written, because the details of this wasn't there yet. If there's something that's written that says we don't want the trust fund, we do. Because this is additional dollars that will be coming into the state and awarded to each of the regions and to the cities based on some of the lawsuits against some of the companies that were producing opioids. And this funding will, this money that will come in from between 8 to 18 years. And it's a significant amount of money for us for opioid abatement. The other one that I think is important is permitting the drug ivermectin. They did actually add more language to that. And that's to be sold over the counter. And there have been some studies done with ivermectin. It was done in petri dishes and not with people. And I know there's some other studies that were being done with people. We know in some other countries they've been using ivermectin. This is not something that we want folks to use without a doctor's prescription. And I don't believe there's any clinicians that are prescribing this right now. but this is what some folks want to do as an alternative, to other treatments. And so that's exactly a deworm for animals. I don't know that. And then the other, making the state vaccine registry and opt-in program. We really want to make sure that we can keep our vaccine registry in place. New Hampshire was one of the last states to get a vaccine registry. It just allows for ease of dissemination for communication of information across different entities like Dartmouth and us, and so we really want to make sure that we can keep that. And then the other ones are, they may or may not be easy to legislate, but the exemption from employers for vaccine mandates, and then the right of conscience for medical professionals, that one focuses on things that have to do with like Planned Parenthood and doctors or clinicians, nurse practitioners saying, I don't believe in these procedures, therefore I don't want to participate in these procedures. So it gives them that opportunity to opt out.
I have a question. So, first of all, thank you, because this is very, very helpful to understand what's going on at the legislature. And in any other environment, I would feel uninhibited to, on a scientific basis, and in our role as Board of Health, to comment on any of these things and provide our professional opinions to inform the process. However, as we know, many things have been politicized in today's environment. And going forward, I would very much like to hear from Steve Bolton. If there is guardrails to what we can say, if there is some template we should use so that we don't, we don't want to contribute to any inflammatory dialogue, but neither do we want to remain silent when we have significant concerns, for example, scientifically, to the points you've raised. Ivermectin is not approved, and it is not scientifically, and there are potentially dangerous consequences to people doing it over the counter. So, as a physician, I would have no compunction of saying something, but the way it's said and the way it's transmitted may cause us to become embroiled in something, or something that would distract from either our primary work or our credibility. So I'm wondering if Steve could be invited to a future meeting to comment on these things and maybe give us some guidance.
All right, I could put that request for him to join us at the next meeting, especially when we're going over some again of the legislative things that we have prioritized.
Thank you.
And so our health officer, Heidi Keith, may have a couple that she'll talk about in her report, and Bob Mack, welfare officer, may have a few that he's looking at in particular to comment on as well. And again, so the first list that we had, when I ran the second list, there was some that again were listed. So some ended up coming off. And these actually are still on there. So, and there's actually now some language, especially with that ivermectin one, which makes it a little bit scary. Other updates, we're continuing to do all of our operations. And right now we have a focus on increasing vaccination efforts. And so Flavia will probably report out for community health of the plans for the upcoming vaccination clinic that we have. We've gotten some updated guidance and guidelines for vaccinations for kids 5 to 11. And there's a lot of complexities in it. It's not as simple as many people believe, with being able to actually implement and get these clinics up and running. So we've got all of our things, and we're making some plans, got all the documentation. Our internal team has met so that we can do this as effectively as we can. We have Finished up with our CHIP update, and Jane will probably give a little bit of an update on that. Accreditation update, Ren led us through an exercise to let us see where we are with that. And we had our PAC, our Public Health Advisory Council meet. Staffing updates, we have our PrEP coordinator, Patrick Henry, who is here, and he will introduce himself when he gives his report. And we also have brought on through the funding through our Enhanced Protection Grant, Mara Santos Lazard, who is a program assistant. So again, with all of our increased efforts for vaccination, we've increased clinics downstairs. We need to have that additional administrative support. And these positions are grant funded. So as long as the grant funds are there, we have these positions. And we were just able to hire a behavioral health specialist, Leah Elliott, who comes from the Boys and Girls Club. She'll be assisting and doing some of the work that Lisa does regionally around behavioral health. And so we have seen increases in mental health, behavioral health issues, in our schools. One of our regional towns has recently, we had a report of suicide, death by suicide of a high school student just this week. And so we know that there's a need for this attention and efforts to be made. So we'll be bringing Leah on in a couple of weeks. And other than that, all the rest of the stuff is here. Highlights, I send out the weekly mentionables where you get to see some of the things that the staff is doing. And that's all I have. That's all I have.
Think about any questions?
Can I ask about Leah then? Is her role an internal one, or is she gonna be working with the schools like you just mentioned, or which?
So right now in the work that Lisa does, as our substance misuse prevention coordinator and our continuum of care, she works with the schools. She works with our youth prevention agencies in the region. And the focus of that work is to reduce, of course, substance use, but also bringing attention and awareness to the issues related to behavioral health. And so they'll make direct referrals, and they'll connect with the organizations that provide the training and bring those trainings into the school setting. So this is an outward facing position. Well, they'll do work with the schools, they'll connect with other agencies that are doing work with youth, and they'll all work together to increase awareness, do referrals, bring trainings in where they're needed.
Providers or clinics call her, or how does that work?
So the position that Lisa and Leah have, they're not counselors, so they don't do behavioral health counseling or screening. I will say that Leah is a trained counselor and licensed, and so she has something that she does on the side that she'll probably be able to do that, but not in the scope of her work with us here at the division.
But she'd be a conduit to say, the families come in
Yes.
and says
Yes,
X, Y, Z, she
Yes.
at least put them in touch with. agencies.
Correct.
Okay.
and in her own, on her side, we also be able to provide services, yeah. Because I believe she's gonna continue that work when she can, but her work with us is not to be a behavioral health counselor.
I think we have some old business set aside on the table. And this looks like the most appropriate thing to talk about. We tabled the idea of using our resources to have people like Dr. Gronick, who is advises the board. I think this might be a good time to start talking about, should we bring on a consultant, well, either a psychologist or a psychiatrist? And do we have any names of people that we've worked with in the past, and then the structure of the public health department and what they can bring to the table? We certainly do not want any deaths, and we certainly do not want kids who are just starting their life to be permanently scarred for the rest of their lives.
Yeah.
So I'm kind of throwing the ball in your court. Do you have any ideas? You certainly don't have to drop a name, but can we move in that direction?
I think we can, and we work very closely with the Greater National Mental Health Center and Dr. Whitaker, who's the executive director there. We rely on her expertise. She does a lot of work with us in presentations and educating our community on behavioral health issues, the 10-year mental health plan. She would be a good person, and if she can, I'm sure she would be able to refer someone else that could be a consultant or come
Can we reach out
as
to
a
her?
subject matter expertise.
Yeah,
Yes.
why don't we reach out to her, explain to her, what the concept is here, and maybe she can come to the board and talk to the board about what role this person, this consultant can do, and what are the avenues that it opens up for the citizens. Yeah,
Yeah, I was wondering if this role, sort of sounds like she, through the course of her duties, also acts like something of a liaison to a lot of other providers.
Yes.
So would we be able to do like an environmental scan to identify like infrastructure needs? I mean, I know we always talk in the news and whatever about how we need more providers and we need more clinicians, but a lot of organizations will find that they have a shortage of clinical supervisors
Mhm.
to provide the necessary bridge from your license, or you're a mental health counselor with a master's to, or master's level clinician to now your license. So, I mean, maybe we can, as a city, look at, okay, where are there gaps, and come up with some kind of shared pool of supervisors or something in that scenario. Maybe she can uncover other things too, where one agency might not have the resources that another one does have, and we can kind of pool.
Yeah, and I think that's where Dr. Whitaker would be really instrumental, because she also sits on at the state level, so that environmental scan that you're speaking of, they've kind of done that in order to get that 10-year plan put in place and things that they're working on as well. So I think she'd be great for that. Yeah.
okay, I know you have.
I have to, I'll come back, I just have to start the meeting for this training.
Yeah, I think it's directed to Bobby.
Well, in the vein that we were talking about, and we can catch her up there. This is very exciting. I know, Tom, you had brought up in past meetings about the need that you see through your work. Alderman Clee, you talk about this in your newsletter. You know, with Bobby now on the board of Southern Hampshire Health, and knowing that Southern Hampshire Medical Center and the Elliott both have mental health programs, St. Joe's with the geriatric program, that the CHIP, I'm sure Jane could speak to this, has also some research in it. I'm looking at Jane, I can't see if she's nodding, relative to behavioral health. And I think an environmental scan would be great, but it would be great to be able to build on what's already out there, knowing that we have limited resources. And I'll defer to the expertise of the team, whose faces I can see up on the screen here, but something like a round table with key leaders from the community, from the hospitals, from Dartmouth, may be a great way to launch that. So again, we know what's been done. We know which things people have tried to do, and where there have been, I don't want to ever say insurmountable barriers, because eventually, we hope all barriers come down, but just that maybe they would have ideas of things that are, close to completion or shelf ready, or things where impact could be made sooner rather than later, even if it doesn't meet all the needs of the things we might like to see happen. So I don't know if that resonates with the team, but I would encourage them to have an internal dialogue about that.
Okay, well, Bobby will start that process. It's gonna be something that we're not gonna be involved with at the beginning anyway. We'll have some kind of discussion at the board level, presentation at the board level. And certainly bring ideas to that meeting. I can't tell you when that will be.
Yeah.
Powers to be, but hopefully shortly. Any other questions on Bobby's presentation? I'll try to answer, but probably won't be able to. But
Just, I guess, an observation. When I was looking at the state's reporting, it said that like 26% or so of the cases that were represented were children. So it kind of points to the increasing difficulties that we're going to face with that population needing vaccination. The fact that it exists doesn't mean that everything is potentially like done. Like now it exists, so therefore everybody's vaccinated. So I mean, have to watch very closely at how schools operate and where people make conclusions, because sometimes the reality doesn't quite fit what people operate on. I know I got a lot of outreach earlier this fall, can we do X, Y, or Z, or can we move X, Y, or Z regulations now the pandemic's over? And I was not fix the data that was presented to me, but I mean, I probably something we have to look for, where people may say, okay, well, now kids have access to the vaccine, so it's parents' choice, but they don't have access if they can't get into a clinic and actually get the vaccine.
We're gonna let Chuck talk about the vaccine, as far as pediatrics are concerned. There's 2 points of view here, as there are always, the medical point, and then there's the political point as well. But Chuck, if you can maybe help on that question, your opinion towards the vaccine.
Well, it's been a godsend that it's available, and it's been, we were all singing Kumbaya last week when it's finally approved. But the logistics of trying to run it, like Bobby was saying, particularly is struggling how to run it, just, so we're starting next week. We'll be running clinics 3:30, Tuesdays and Thursdays, 3:30 to 8, staffed by our support staff who want to, some extra money or time. But right now, Walgreens and CVS are not doing it, but Walmart and Rite Aid are for kids. I think you're hitting the nail on the head, because as much as I've been promoting the vaccine for all this time, parents will just still say it's too new, when kids don't get sick. Well, kids get sick, and they have the ability to fight it off, but kids die from this, and they get morbidity, sickness from this, and mortality, and so that's where the rubber hits the road, because now that it's available, now we're saying, let's do it. We're getting the same pushback that we had with the flu all these years. Oh, I just need a little more time. I need a little more information. What information? Have you had your head in the sand for the last 18 months?
Even the adults, the parents, we're only at like 50-something%, because people were like, someone else will take a shot for me.
So yes, and yet we know that, it works, and the studies have shown of 3,000, patients that had it, that same success rate, 91% of that effectivity, and those that are vaccinated had fewer COVID side effects, and it's really statistically sound, scientifically proven. It's available now, and it's just that, all wonderfulness gets hit as soon as and most parents are saying yes, I will say that. But the few that are probably always going to say no, you have to pick your battles on how to say it. So I think all we can do in a public advocating way is say, it's a free choice, correct, but you're going to live in a family that the child is going to be going to school, daycares, and you've got sick people in your house that are older. It's a nice way to protect your grandparents and relatives and other things. And so my ability to be creative in my dialogue has really been challenged, because I thought it was a no-brainer that we just do it. And sadly, it's like anything else, it seems like it's, oh, here we go again. So,
I appreciated the presentation you guys did, asking questions and what are your concerns about vaccination, because that's really helpful to give to the community, because they're sharing their own information, they're doing their own research, and they're coming up with, I think extraneous, red herrings, if you will, where they will focus on like, well, this specific mRNA is brand new, we don't know anything about it.
I just want to move on, because we do have a time limit.
So a couple of quick things. One is, Dr. Petty, you had pointed out before that the clinics you discussed from Dartmouth are for Dartmouth patients. I just don't want.
oh yeah, so yes, no, I will say that. I was going to say that's for the Dartmouth patients and family practice, but at the same time, but there are going to be, there's the vaccines at the other places are all available, and at the commercial places, Walgreens.
I just wanted some clarity in case some people are listening. And the second thing is that right now, we need to keep in mind that only about 25 to 30% of parents have stated on surveys that they will commit to vaccinating their children. Another third are waiting to see what happens, and another third have already made a decision. That decision may change with additional information. And I'm very impressed. I know we'll look at some of the work that our team at the Public Health Department has done to educate. And I know that they were standing at the ready to do additional education about children. And I think the biggest barrier that we might face is the concerns about myocarditis. Because Moderna, there are some countries and so forth that are saying no Moderna under 30. Because of the risk of myocarditis, but the fact that myocarditis is more common with the virus than with the vaccine is important. And the fact that these are Pfizer at a much lower dose. And finally, it's important for people to understand that it's about illness and it's about preventing long haul COVID, which kids do get, but it's also about keeping our schools open. Boston just shut down a major school system because COVID was very prominent. And so we don't want to be forced to be in the same position and have to have businesses or others shut down because so many people are out. Not because, you know, we're trying, I mean, also to prevent spread, but also because there's just no staff, no students, because they're all home sick. So these things need to be taken into account as well.
I just have two real quick questions. One is the clinics that you mentioned from the city. I thought I heard that they were closed because they were full. Is that the case, or do people still get it?
Well, so yes, my caveat for those that I mentioned were still Dartmouth-based.
Not the Dartmouth one. You said there's actually 3:30 to 8 p.m.
Yeah, that's the Dartmouth.
Oh, that's the Dartmouth
That's the
one.
Dartmouth.
Okay, but the two that the city had scheduled, those are full.
That I have to clarify with Bobby, but I.
That's my understanding,
That's
but
I kind of got that impression yesterday at our meeting. And the other question is, I come from a ward that we have a lot of anti-vax in general, not just, not COVID, just in general. So this 25 to 30% of parents that will commit, is that pretty common with vaccinations in general? Are we seeing?
no,
No. Okay.
not vaccinations in general. I mean, people have given their kids mumps and measles and, you know, polio, and now that may change. And I'm concerned that some of the legislation is talking about not allowing mandates, you know, for kids going to school to have been vaccinated against polio. And I know there are some very prominent members, I don't want to get political, very prominent members of our federal legislature that have been affected by polio. It's a devastating disease and we wouldn't want it to see. So throughout the country, those statistics are pretty, you know, obviously there's pockets where people are more or less in favor, but that statistic about a third is kind of a national statistic about COVID, but up till now has not been the same approach for childhood vaccination.
Well, it's about 10%, I would say 10% of the population I've seen over 30 plus years of practice here in that is still anti-vax, regardless of what you say.
Right.
So 90% are positive, that's a
Right.
good way to look at
Yeah.
it, but that 10%, they're not gonna budge.
And I know the schools make necessary arrangements, so if someone got whooping cough and they didn't have vaccine or someone, we still give them education, but they separate them and so on. So I don't want to really belabor, so I just wanted to know, so this anti-COVID vaccine is much higher than we would normally see in
Correct.
other vaccines.
Correct.
Okay, that's what I just wanted to kind of grasp that.
The biggest reason is I just don't know enough about what they're saying.
I think the other big thing, from what I've seen from the patients coming in is, and asking questions, is it's artificial. And they have a problem with that, right off the bat. And.
Tony, I'm not sure people can hear you
Oh,
when you're
okay.
leaning this way and with the mask.
Probably they can't because they're all awake, nobody's asleep.
No, Heidi.
Maybe Heidi was dozing off, I'm not sure.
She was-
But anyway, we're seeing, the problem being the fact that it's an artificial RNA and people feel that, how is that going to affect my kids? It's interesting, we'll have parents who have taken the vaccine but won't give it to kids. Type of situation. So, and a really good friend of mine, just came down with it, just recovered, who was vaccinated, he got it from his grandchild. So even though you're vaccinated, you're not always safe. And then little kids are falling over, going on and the whole thing, both he and his wife got So, I mean, you can't just say, well, I'm vaccinated and I'm protected. You still gotta use common sense.
Just one quick question.
Sure, go
I know this is still really new, so probably no numbers, no data. But what are the actual effects of getting the virus in children?
Mhm.
And what their long-term effect is throughout their life, because during their growth period versus getting this artificial RNA. We don't know.
We don't know.
We don't know what's
Yeah,
going to be.
we don't have enough
in
data.
the long.
Yeah.
Okay.
Well, we are
I didn't
seeing,
think so.
we're seeing long hauling in the adults. In fact, the American Dental Association just came out today with a warning to dentists that you're going to have patients who have these issues and who are going to be on medications. They have respiratory issues where you can't bring them all the way back to the chair. They're going to be on special cardiac medication, and you're going to have to take care of them, some of them blood thinners, et cetera. So
Kids or adults or both?
we're talking adults at this point, because we don't have enough data on the kids yet. So when somebody says, well, I thought that I'll be okay, yeah, maybe. I can't tell you are if you're not, but if you're not, you're gonna have to deal with these for the rest of your life. And also, you gotta remember, the public will be dealing with it too, because somebody has to pay for that.
My concern is with children getting it, how it affects the rest of their life. We have less life to live, and they could just start, and then their children, et cetera.
Sure.
It's just thoughts that go through my thinking.
Okay, I'm gonna cut that a little bit short because it is 1:15 and we gotta really get through this stuff, guys. Is Kim here? No. Who would like to take on the community health? No volunteers, going once, going twice?
Oh, it looks like Flavia's trying to talk, but we can't hear.
Yeah, I think you're on mute, Flavia.
She's not on mute, but we can't hear.
No,
Now,
Right
can
now.
you guys hear me now?
go for it.
Okay, I guess the headset works. Kim's not with us today, so I will just
thank you. I didn't
go
know that.
through our highlights here. So during the month of October, the community health team has continued to provide our routine services to the community, our clinical services, outreach. We've been continuing with the COVID-19 vaccine, education, and disease investigation for clusters and outbreaks only. We completed the Nashua School District in-school influenza immunization clinics, and we vaccinated just over 1,850 students and staff. For comparison, we didn't do in-school clinics last year in 2020 because of COVID, but in 2019, we did 1,360. So we saw a little bit higher numbers this year, which is good to see. Since the COVID vaccine was approved last week for the 5 to 11-year-old age group, we did receive our standing orders. So we began administering pediatric COVID vaccine during our clinics here. And we will also be hosting a child and teen COVID-19 vaccine clinic on November 20th. So next Saturday, not this upcoming Saturday, but the following Saturday at Elm Street Middle School. This is going to be for the greater Nashua region. We opened up 700 appointments. Those were booked almost immediately. And we're also taking in walk-ins as well on that date. We'll follow up with a second vaccine clinic 3 weeks later on December 11th. And we also plan to offer another pediatric vaccine clinic in another town within our region coming up in December. So that, well, more to come on that. Regular clinical services, we added an additional clinic on Wednesday mornings. We have seen all of our Tuesday, Thursday, Friday clinics have been booked solid. We added an additional clinic on Wednesday morning for STD and immunizations. So now we're offering clinic in our building 4 days a week. And we also provided City of Nashua employee flu and COVID booster clinics in the month of October and December. And I believe these are all the highlights.
Thank you, Flavia. Any questions?
I have a couple of questions, Flavia, and I thank you for standing in, and I appreciate that you might not have all the answers. First of all, I want to commend the team for adopting the new guidelines for blood lead levels and sticking with the lower number that has been recommended, even though the state of New Hampshire has not updated theirs. Very interested in the what's being characterized as the high demand for STD testing and immunizations. Obviously the immunizations we understand, but the STDs, is that something that's been a continuing trend? And is that something we need to bring to the attention of our primary care practitioners in the community? I'm just going to ask my questions and then let you talk, so if you don't mind. I was noticing that the number of syringes given out to SANA is quite high compared to the numbers returned, and I wanted to see if anyone commented on that. Also, my last thing has to, it keys off something Alderman Clee was saying. With these community clinics, do staff feel safe? Have there been any concerns about anti-vaxxers showing up? And do we have security if needed for these clinics? So those are just my areas for comment. Thank you.
Flavia, I can answer that last one if you want.
Go for it.
So for our, I'm mixing up all the dates, but for our November 20th, we've already secured police detail for that with those same concerns in mind. And we also have a fire presence too for health reasons, but.
Right. And during our in-house clinics, we have never had any security concerns. But that's something that we definitely have in mind in, during these public clinics where anybody can walk in, but we have luckily not had any concerns. In regards to, what was it? I try to make some notes here.
STDs and SANA.
Yep. So the STD clinics, we have seen an increase of people seeking services. During COVID, a lot of services were closed down. So we were seeing an increased number of folks all around from the state, from Massachusetts, and those folks do continue to come see us, and our clinics have been booked solid. In regards to numbers coming back positive, I would have to check with the STD program coordinator to see if we have seen an increase in that. I had a conversation with Dr. Nita Arif not too long ago in regards to syphilis cases. Those numbers have been up quite a bit since at least a year, and we do get a lot of referrals for treatment in that area. And for the SANA numbers, I know people have different options in regards to returning syringes. We do work alongside with Revive and Doorway. So I am wondering where those syringes are getting returned. I can look more into that and seeing what services perhaps people are utilizing in a community.
Yeah, that would be great, because the reason I ask is we don't want a lot of, syringes out there that people don't feel that they have a good repository for. So I know that you guys are always thinking ahead with these things, but then Emma just jumped out. I'm not sure that the average practitioner would be aware of the fact that we're having an increase in syphilis, although it's not surprising. On several levels, I would ask that somebody look into whether that's being communicated to the major physician groups at Dartmouth, St. Joe's, and Southern Hampshire Health /Elliott. Thank you.
Thank you.
Comment on that.
Yes, go ahead, Chuck.
Pediatricians across the country that's the number one thing we've seen is syphilis. It's actually syphilis and GC, the STIs have gone through the roof in the last 18 months. So who would have thought we'd be treating syphilis? And no one explained why. And so, no, it's on our radar screens locally, and I just have had conversations daily with that topic right now. So it's really an epidemic of very concerning proportions.
Or contracting.
Excuse me.
Are they born with it or contracting?
No, contracting. Oh, yes.
Spend a little too much time indoors.
Yeah, I mean, it's a multifactorial reason, but it's just all what my reading is, that no one can figure out why, apart from behavioral health saying, along with suicide, that it's just, we're just in a new world, and the stresses and everything else is coming out in different ways. Not that syphilis is a stress issue, but they're undertaking risks that they didn't take before, and maybe blowing off the prevention factors that we used to take for granted.
In addition to the fact that for the last year and a half, it's been difficult to see physicians in person, and, you know, you're at home and you're telecommuting into your doctor's office, you may not feel comfortable talking about what you've been up to. And we know that we are concerned about an uptick in all kinds of diseases that were not caught early, or prevention was not undertaken.
Makes sense. Not to cut off discussion, but Flavia, do you want to add anything?
The only thing I'll add in regards to STD is that this past month, we partnered up with Revere University to offer services there on campus, and we've reached out to NCC and other regional areas just to target more people that we heard that there was a need of students at that age that may not seek services because they don't want it on their parents' insurance and you know, that kind of thing. So we partner up with them, and we're going to continue to partner up and with, you know, other local facilities too, to offer that.
See no other questions or comments, and we're crunching for time as always, but they're all good questions. And I know Nicole is biting at the bit to talk. So Nicole, wake up, Nicole. Nicole.
Nicole?
Don't you just hate that?
I'm here. It's a little hard to hear you guys. It's very muffled. So I was trying to listen really intently. That's why I was leaning down. Sorry about that. I promise I was not falling asleep. So hi, everyone. So just to kind of go off what Flavia said, we've been working really hard to get information about the 5 to 11 vaccines out to parents. So we did create the flyers for the clinics, and we did have those in multiple languages, and our community health workers were also pushing them out along with the school districts. We've posted information on our social media, our website, throughout the region, and we also send a press release out to the media to get the word out as well. I've also been working with the local hospitals to share any videos or interviews they're doing with pediatricians about the child vaccine. So hopefully we'll see some more of those. But I know St. Joseph Hospital did one last night that we shared, or on Monday night. Other than that, the community health workers are also there just pushing information to their parents through their channels in different languages for the child vaccine. We also held a COVID-19 vaccine listening session via Zoom. That was at the end of October with Dr. Marie Ramos, who's a well-known healthcare provider in the Nashua area. We had a few folks join us asking questions about the COVID-19 vaccine, and our hope is to offer more of those sessions either on Zoom or in person within the coming weeks. In addition to COVID, in October, we're working on our Halloween safety messaging. We promoted Drug Take Back Day in the Greater Nashua region. I worked with Bob in welfare to update our homeless resource card that we're working on getting printed and getting out to local organizations to hand out. And then we're also in the process of planning to get information out about HIV testing for World AIDS Day that's on December 1st. So we're going to be having a clinic from 9 a.m. to 2 p.m. on Wednesday, December 1st for HIV testing. So there's more information coming out soon about that. Other than that, we're also just planning for holiday safety messaging. We have Thanksgiving and Christmas coming up. So food safety, COVID safety, flu, all of that messaging we're planning on getting out within the upcoming weeks, as well as mental health messaging. And that's pretty much all I have, short and sweet.
Thank you, Nicole. Busy as always. Any questions?
Not a question, just, I don't know how accessible this is, but Sesame Street had a town hall that was very controversial with Big Bird getting his COVID shot. So I don't know if that's something we can refer people to. I haven't seen it myself, but
It was good. I watched all of the Sesame Street CNN. That's really good. Good friendly.
Okay. Thank you, Nicole. Moving on. Jane.
Hello, everyone. In the interest of time, I'm going to be very brief. And I just, we continue to host Public Health Matters to kind of align the messages of what the prevention months are with the content. We always have a COVID segment on that as well. I'm hoping to get a pediatrician on early December if possible. We do have a newly enlisted CDC Public Health Associate, so I'll be working with Mackenzie, who's on this call, as she gets settled in. And our Community Health Improvement Plan, we did have our executive committee meeting, and we did review all the goals and objectives for the 5 priority areas. And for those of you who don't know those priority areas by now, but they are behavioral health. I hope I can rattle them off quickly, but behavioral health, communicable disease, chronic disease, maternal and child health, and public health emergency preparedness. So the executive committee had some really good suggestions. We'll be taking those back to the work groups before we can load all of those goals and objectives onto a new online platform. Similar to our CHA, we will not be printing out a version of the chip this year. We will be putting it all up online. Continue to be the division lead for the chronic disease work group. We're looking at depression, diabetes, and hypertension as a primary prevention issue. We had our annual FAC meeting is just scheduled for February 10th. Co-lead on the Kresge Foundation grant. We're looking at trust issues in the BIPOC community. And we got our report yesterday. So we're going to move forward with the information that we have received from that and start creating a script for some provider interviews. Also working on Gilson Road in our inventory so that we are prepared as we move forward. And been interviewing candidates for our epidemiologist position, and we welcome Pat Henry aboard as the FEP coordinator, and I'm glad to have a partner in crime. So that's all I have.
Jane, may I suggest our pediatrician resident here?
I've tried, but you know, I'll circle back with Dr.
Well,
Chuck.
he's got a new agent now, so I think you can be able to work with
Yeah,
him.
he said he'll be happy to, so I'm writing that down. Chuck is happy to.
We'll chat offline, my friend. Thank you.
Okay, anything else from you? Thank you, Jane. Looks like we hooked you guys up. Who is doing behavioral health? I don't have.
So that's Lisa's report.
Okay.
And so she worked, organized and to set up for Red River Week, which happened in October. Also worked with our staff and did a door decorating contest that you guys saw downstairs. I think it might still be up, but for Prevention Looks Like Me or something like that with the mirror downstairs. And this is again some of the work that she does in the region, right? Again, to push out and promote education around substance use disorder and prevention of that. Worked very hard with the National Police Department for Take Back Day, and this was also regional. So went around the community health workers, got the Take Back boxes out to all of the region, and we had, I believe, 12 towns participate in that, which was great. And then she listed down some of the other events that she was engaged in or that she facilitated during this the month of October. And she facilitates the Mayor's Opioid Task Force and the Mayor's Suicide Task Force. And that's where we bring the schools and other partners to the table to discuss what we're seeing. We had, we're back as far as overdoses. We're looking like we did prior to COVID last year. So during last year, it looked like the numbers had gone down. Now the numbers are back to where we need to really pay attention to what's happening. And she was also called on Monday because she's trained in DBART, which is the behavioral health assistance when there is an incident such as a death by suicide. So she was called over to Hollis to be there with the other folks to provide support to the students in the school. And Lisa also partners and hosts the Public Health Hour on Friday. We do the radio. And she does part of it in Spanish for our individuals who listen who speak Spanish. So but you can see all the different activities that she's done. And because this is regional work, this is why we need to have that other person so that we can divide and conquer.
Any questions from the gang? Great stuff. Seeing none, another busy person. Well, now we come to Patrick. Welcome, Patrick.
Thank you.
The honeymoon's over.
Throw my fire.
Yeah.
That beat up belly now, we get it around running, and it's
I
very
probably want to
Thank
see closer to the door.
I'll remember that.
Welcome. Anyway,
Thank you.
glad to have you on board.
Glad to be here. Thank you very much. So everyone else has pretty much mentioned all of our COVID response, so I won't harp too much on that. I will say we've had, my report said 2, but as of today, we've had 3 regional partners reach out to us, the emergency management directors, asking for regional clinics instead of kind of a Nashua-centric clinic. So Jane and our community health department as a whole, we're all working on that to kind of develop those. As Bobby mentioned yesterday, we were a part of the state's call, and Dr. Chan discussed in depth the complexity of these school-based clinics, and that's what our regional partners are really asking for. So during our bi-weekly regional EMD talk today, I very directly explained the complexities, and we're going out to these 13 regions, but we already met with Nashua. We're going out to Hudson today to start that kind of drive to open these communication portals, so to speak, but also to describe in person these complexities. So we're going to be starting to do that today. We are still hosting our bi-weekly emergency management director meetings to have that line of communication. And as Jane mentioned, our inventory at Gilson Road is still underway. We're going over there again tomorrow to just continue that. But I will mention that our 2 trailers for either an ACS deployment or a pod deployment, they are both ready to go at any time. So we are able to respond in an emergency. It's just really, confirming our inventory and really shoring that up. Outside of COVID, we are tracking the FEMA course compliance in the entire division. That is underway. As mentioned, Lisa is hosting the Public Health Radio Hour, and my first and second week, I was a surprise guest on that, so I was able to go on and talk about risk reduction strategies. To me. I didn't know that I was going on, but it was very nice. We were able to talk about risk reduction strategies related to getting COVID-19, especially coming into the winter months and people being inside. Let's see, I am slated to attend some virtual courses to further my education specific to the position. As I mentioned previously, we have meetings that we're starting to set up with our regional health officers and emergency management directors to kind of confirm those partnerships. I am reviewing and updating some of our PEP documents, especially now that we've moved back into 18 Mulberry. There are some mainly diagrams and things like that that need to be updated. So I'm currently reviewing that. And finally, Bobby, Jane, and myself, we were able to attend a tabletop exercise last week hosted by St. Joseph's Hospital on a hazardous materials response and how the various stakeholders and partners who were there would participate in that. That's all I have.
Thank you. Any questions for Patrick?
2 quick comments. We're talking a lot about COVID, rightfully so, but I don't want to lose track of the messaging we usually have at this time of year about flu. They say it's going to be a very bad flu year because of everybody's isolation last year, and that people should get those vaccines, and that they can get them at the same time is a common misconception that they can't, which makes it easier. The other thing is just, what happens when the power goes out. We usually also promote, where to go, how to stay safe, how to maintain food safety when your refrigerator's off for an extended period of time. And I just don't want to lose sight of those things. Thank you.
Thank you, Stephanie. Yes. Alderman Quinn?
Thank you. It may have been addressed, when we were doing the COVID clinics, both testing and giving vaccines, we went out to the community to underserved areas. Are we considering doing anything like that when it comes to the children? I know you talked about the schools, but not all children are in the schools, and not all of them are in the public schools, and so on. I mean, I think of places like French Hill and some places around here that are very underserved. They don't drive, they can't get there. Are we considering doing anything like that?
In the future, absolutely, and I'm sure, community health, I'll speak on that a little bit, but we are hoping to reach those, underserved communities, communities that, like you said, they, due to a social determinant of health, like they can't drive or something like that. We can reach, right, yeah, we can reach out to them, absolutely.
Any other questions? Thank you, Patrick. Obviously, somebody forgot to tell you that you were supposed to bring brownies today. We'll forgive that.
Yeah.
Thank you very much. Welcome on board. It looks like you're too busy already. And I can tell you, Patrick's going for his Master of Public Health.
Excellent.
And he's pretty close.
Yeah, pretty mad.
So congratulations on that. That's a lot of hard work, I know. Heidi. Stop snoring.
Good afternoon, all. Heidi P. Kokoka, Nashua's Health Officer. I'm going to be really brief.
Thank you.
Consider people's time. Did want to mention the legislation that Bobby, I almost called you Victoria, that Bobby had mentioned, the LSRs that we're watching. It's hard to gauge where some of these are going because the titles that have been given the LSRs are so vague. But certainly we're watching things that are around food safety. That's a primary concern for us. There are a few that we assume to be food related, such as cigar bars and beverage manufacturers. There has been one LSR proposed relative to establishing a statewide permit for food trucks. We'll be very interested to hear how that discussion goes. There are varying resources and levels of expertise across the state. Certainly the state inspectors are very well trained, but so we're looking into that. I think I can see somebody's screen instead of the report. I don't know who has the power. I'm also looking at one relative to the inspection of public lodging houses and want to see if that will end up being rooming houses or hotels and motels. And most people don't realize that most of those activities and entities are largely unregulated. So that may be a good thing, but it remains to be seen. As far as food service, we've been busy. We've had some curveballs. It seems like everyone has gotten very imaginative to food service with post-COVID and trying to recover. We've been dealing for a few months, and I may have mentioned it previously, with an alcohol-laced ice cream product. And it's confusing and it's very involved. The state had told us what they would require for licensing and listed some things that we then required, and then another bureau of the state went ahead and licensed the product. But the product is actually made in Massachusetts. So we're talking to the GOV Board of Health, and it looks like the final determination about the product is going to the Massachusetts ATF, which is fascinating to us, but also we hear that the dairy that was producing it is no longer going to produce it. So it remains to be seen. Another interesting thing that has come up is, I'm just going through my notes, a proposed kava bar at 300 Main Street. And we are very much opposed to that. And we have received information from the state liaison for the FDA that that's considered an adulteration of food products and it is not allowed. So we've sent the information to the owner-to-be and have not heard back from him. And for anyone's clarification, Kava is Piper methysticum. I'm probably, yeah, I'm pretty sure I just mangled that, but it's closest to a benzodiazepine, that type of effect. So I know that Lisa has provided some support for not having people imbibe with something like this and then drive away, and Revive Recovery was also interested and opposed to it. So I'll keep you all updated on that. The other thing that we had was we condemned a property as unfit for human habitation. That's not necessarily on the report because it didn't really fit under any specific category. It was a 2-family because there was an interruption in the sewer going to the city sewer. And so it's been interesting. The property has had some legal activity with an abutting property, and turns out that, yeah, it's a long story, but everyone has vacated the property, which was our thing. We did not want people making more sewage waste without it being sent safely to sanitary sewer. So that's another thing that we will give you some updated information as that plays out as well. We work with a great team of people across the city, and Urban Programs was very helpful in trying to assist that property owner and get it rectified as soon as possible. And I think that's it. Ren, do you have anything else that you'd like to add?
Thank you, Heidi. No, I do not have anything in addition to what you stated in the report.
Brent, how's the accreditation going?
So no updates from last time. So we gave a presentation to the FAC Executive Board briefly last week. So we continue to work with the new version. The vetting process ends this week. So then FAB Board is now reviewing the comments that they received during the vetting process, and we'll work on the final version of version 22, which will hopefully debut in January.
Thank you very much. Keep us posted, please.
Absolutely.
Thank you. Thank you, Heidi. Any questions from the board?
I have one last thing, if I may.
Yeah.
You may hear about this. I don't know that everyone is aware of what the plan is for Nashua Housing Authority's Bronstein units. The package of demolition paperwork just came in today. So we signed off on that, all of those. And it's a rigorous process for them. They had to have thorough inspections for the presence of asbestos. And then they have to do clearance testing post abatement as well. So if anybody would like some more information about that, I have the entire packet on my desk right now. It will be filed. But you may hear something about that. So wanted to give you guys a heads up.
Thank you.
Does that go to the Board of Aldermen too? Your packet?
I don't think so, because it's a building department sign off. Ultimately, we just have a small piece of it. So building department issues the permit to allow the demolition to occur.
Well, we got 2 aldermen who had left, and I was going to say if it's something that concerns them, to make sure you put them in the loop, but it sounds like it doesn't.
Oh, okay. I'm sorry. I misunderstood.
No, I didn't really finish the question, so it's not your fault. Any other questions? Thank you very much, Heidi and Ren. Bob, go for it.
Good afternoon. Bob Mack, Welfare Officer for the City of Nashua. Just reporting out on the statistics for the month of October in the Welfare Department. You can see not drastic changes in our operations. You could say it's pretty much business as usual. We did see a slight uptick in comparison to last year in requests for utility assistance. That could be attributed to the fact that last year at this time we were in a COVID moratorium and utilities weren't getting shut off. This year we are point of the year where we're moving into the winter moratorium, which starts November 15th. And it continues on till March 31st. So a lot of folks are coming in. The utility companies tend to send out a lot of disconnect notices just prior to the winter moratorium. So we've seen a slight uptick there. We continue to assist, refer people to the fuel assistance program through Southern New Hampshire Services, as well as the emergency assistance program that is being managed by the CAP agency as well, if it is COVID-related hardship. So again, the numbers are fairly level as far as contacts, interviews. Our budget is looking good. We're in good shape as far as that goes. We continue to work with our community partners addressing the homeless issue. We refer people to shelter programs as available, and a lot of referrals come through the crisis assessment and referral line. At the beginning of this month, on the 2nd of November, there was an outreach, a coordinated outreach effort that took place where some 20 outreach workers went out in the community to try to capture some information on our homeless population. There should be more data coming out on that probably in next month's welfare report. Actually, our Sandra Delosa from our welfare department, our senior case tech, participated in that outreach effort. We also generally have community health workers that participate in that. And this was sort of a precursor to the planned annual point in time count, which takes place every year towards the end of January in coordination with the statewide effort to get a point in time count with the homeless population. Let's see. Director Bagley had mentioned some of the LSRs that we're keeping our eyes on. As noted, some of the LSRs are kind of general and not too specific, so it's hard to figure out exactly what it may be until it is put into a clearer form as a House bill or Senate bill. But there are a number of LSRs that are relevant to zoning and regulations around affordable housing. There's some around prohibiting discrimination of tenants holding certain types of Section 8 or subsidy vouchers. And as Heidi had mentioned, some of the things around housing that we keep our eyes on. They keep an eye on it from an environmental health perspective. We kind of keep an eye on it from a housing availability perspective. So we'll just keep our eyes on those as they are formalized into actual legislation. I think that's about it. I don't know if there are any questions.
Thank you, Bob. Any questions? You good? We're good, Bob. Thank you very much. Thank you, gang.
Thank you.
I'd like to take the opportunity to say you're all hardworking. Enjoy Thanksgiving with your friends and your family. Stay safe, and we'll see you next month. I'm now opening it up to public comments. Are there any? I don't see anybody lighting up the board here, so I'm going to assume that there is not. And with that, I'm looking for a motion to adjourn. Motion second. All those in favor?
Aye.
We are adjourned.
Thank you,
all.
everyone. Happy holidays.
Yeah.